Hello everyone, I am Dr. Tushar Chokshi, respected chairperson, honored delegates and viewers. Greetings from India. It is a true honor to be with you. I extend my heartfelt regards and warm welcome. Today I'm going to explore in next 10 minutes the future of anesthesia in 2030. My vision, which I have seen since last 10 years. It is a precision in every breath and compassion in every bit. So I will talk about future anesthesia workstation, future TCI-TIVA infusion pump, future anesthesia vaporizer, future next gen airways, future next gen anesthesia drugs, and future anesthesia practice in 2030. So all these things together in 2030, how we will practice anesthesia after 5 years. So first we will go for the next gen anesthesia workstation. See how it will look. Our next gen anesthesia workstation will have AI smart console, like it predicts and losing, alerts risk, learns from global data, touchless and voice control, like they are inbuilt Alexa, Siri, voice command. It will be sterile gesture based personalized dashboards, closed loop delivery. It auto titrates the volatile agents, TIVA, relaxant via depth of anesthesia monitoring, next gen monitoring. They will have a hologram monitors, non-invasive organ indices, microcirculation, cerebral oximetry, green and sustainable zero flow gas recycling portable battery backup design. It will have a robotic and remote care, either two robotic arm or one robotic arm for intubation or robotic USG guided blocks, anesthesia for remote or war zone, AR support, overlays vitals plus 3D anatomical guidance for precision, patient-centric safety. It predicts the adverse events, whether patient goes in the hypotension or hypoxia. It will auto-rescue protocols built in. And it has got I told you that it has got a holographic monitor with real-time genome studies and solution. So once you put the studies in this anesthesia workstation, then workstation will itself gives the dose regime to the patients and going for anesthesia. And there are integrated AI monitor with Wi-Fi, Bluetooth, Alexa, and Siri. So in 2030, anesthesia workstation will not just monitor or deliver drugs, but it will think, predict, prevent, and protect. So how it will look? This is my blueprint of the AI-enabled anesthesia. How it will look? Because it has decision support, voice command, depth anesthesia monitoring, pain and fluid management, and automated drug delivery. This is just blueprint. I have drawn it, but actually looking this type of the workstation, how it will look in 3D picture. So this is the picture of my AI integrated advanced anesthesia monitor. It will cost around US dollar 2 lakhs to 5 lakhs rupees. It is fully loaded with the state of the art modules like robotic, closed loop arm, closed loop AI, multi vaporizer, advanced AI monitoring, and drug cartridge. This has got two robotic arm which will intubate or give a USD guided block. It has got a holographic monitor. It has got a AI console here. So everything is inbuilt, and you do not have to worry about this. This type of the my imagination of this. And in 2050, when there is a chance when I will live up to that mark, today I'm 60 years old. So in 2050, I presume that there will be a switch on switch off anesthesia machine will be available, and it has got only one machine, one button. If we want to put the patients on sleep, then there is a sleep mode. And when the patient wants to awake, then we out of the anesthesia, then we want to put that patient on the awake mode. And if you want to take a coffee in between during anesthesia, then you can have this coffee vending machines also. And there is a AI monitor. Everything is like in these consoles. My next one is next gen fourth generation TCI-TIVA pump. It is AI powered control, learns patients' genetics and physiology, predicts recovery and side effects, closed loop feedback like auto titrates drugs via EEG, BIS, hemodynamics, nociception, null monitoring, smart multi-drug cassettes, pre-filled and barcoded, error-proof, no manual mixing. So these machines are AI proof, wearable and wireless, compact, portable, shares data with OR, ICU, and AR. It is battery backup. There is no wire to connect on the electricity. AR guidance, real-time visual trends of effect site concentration versus depth, green and sustainable, biodegradable cassettes, minimal wastage, micro. So all the drug cassettes are inbuilt in that part. Softwares are inbuilt, built-in safety nets, predicts drug interaction, auto alerts, and antidote ready. So if some drugs are allergic to anyone or reaction occurs, then it gives antidote immediately from this next gen TCI-TIVA pump. TeleTIVA, remote monitoring and cloud-based dosing for rural access, and integrated AI monitor with Wi-Fi, Bluetooth, Alexa, and Siri. So these pumps will have all these features which we have in the anesthesia workstation also. So the TCI-TIVA pump of 2030 will be intelligent, predictive, wireless, safe, sustainable, and patient-centric. Like that, I have also developed this machines of fourth generation TCI-TIVA pump. It will be like my dream. Estimated cost of this will be US dollar from 80,000 to 120, 1,20,000. So in Indian rupees, it is 65 lakhs to 1 crore. And advanced research, it goes more 1.2 to 1.6 crore. And in mass production, it goes again the low price from 30,000 to 50,000. So this is approximate cost in 2030. And it has got what I have told you in the previous slide, integrated with AI, big data, closed loop control system, multimodal inputs, adaptive and predictive towards fully autonomous anesthesia. So this type of the pump have CLADS and TCI both included, and it is AI. So it gives everything whatever you want in the future part. My next is next gen anesthesia vaporizer. If you are not working with the TCI-TIVA and if you are using a vaporizer, then my vaporizer is a 3-tank technology, and it has got all the cartridge in the same. You can fill either isoflurane, desflurane, or sevoflurane in the same bottle, and it is mounted on the trolley also. So it is AI adaptive control, auto adjust agent dose using depth, hemodynamics, and nociception, closed loop delivery like automatic MAC titration predicts emergence, optimize washout, smart digital cartridge like barcoded auto recognize error-free zero cross contamination. So I told you about 3-tank technology. Once the sevoflurane is going on, then automatic it will shut the tank of this isoflurane and desflurane. Eco-friendly design, near zero flow, gas recycling, catalytic neutralization of the emissions, touchless interface, voice gesture control like we have inbuilt Wi-Fi, Bluetooth, Alexa, Siri, personalized presets for all patients groups, real-time monitoring, tracks uptake and tissue saturation, organ specific effect, fail-safe safety net, auto setup, oxygen only backup, AI alerts for the dose and leaks. So it will monitor according to the depth of the anesthesia monitoring in the patients. If the patient goes in the deep state of the anesthesia, then the inhalation agent will be cut off. And if it is becoming light in anesthesia, then the more dose will come, and it will be decided by this 3-tank technology by AI powered. And global connectivity, cloud linked, enables benchmarking and tele-anesthesia server. So this vaporizer of tomorrow will be intelligent, sustainable, safe, and protective for both patients and planet. This is my vaporizer, my own advanced AI vaporizer of 2030. It will be around where 2 lakhs to 10 lakhs rupees, 10 lakh US dollars available. So it is, I give him name is as a TMC vaporizer. So this is 3-tank technology. Again, new generation airway instruments are also 2030 will be having AI video laryngoscopes. It will be 3D, three-dimensional, augmented reality assisted with predictive guidance, robotic airway aid, precision placement with the fewer failures and trauma. It has got smart endotracheal tube, sensor equipped self-adjusting cup. You do not have to worry about the cup pressures. Drug eluting safety. It has got a drug itself like xylocaine or something else. Bronchodilator will be inbuilt these tubes. Hybrid supraglottic airway. These are the auto sealing, sensor embedded, and it may convertible to the intubations in emergency. AI airway monitoring, non-invasive prediction of the obstruction and collapse, touchless connectivity, wireless alerts for the displacement of the leaks, portable scopes, pocket-sized disposable, ideal for emergencies, eco-friendly design, reusable optics and biodegradable disposable. In ETT also, we have a sensor for the oxygen concentration and for the ETCO2. So airway instruments of the future will be intelligent, adaptive, predictive, and eco-conscious, ensuring universal airway safety. So these are the type of the holographic airway instruments that will be available in 2030. Next gen anesthesia drugs of 2030. Every year we are introducing newer and newer intravenous agents. So my prediction is that we will find out ultra short hypnotics like seconds onsets and minutes offsets, and they will be liver and kidney independent metabolism, genomic tailored agents. So personalized dosing, no variability effect in effect. They will choose the drugs according to patient's genomics. There is no side effect, free drugs, no cardiorespiratory depression or no post-operative nausea vomiting, no delirium. Organ protective anesthetic, neuro, cardio, and renal protective with the anti-inflammatory action hybrid. And my dream is to develop one molecule which has hypnosis, analgesia, amnesia, and relaxation all together effect in one drug. Eco-safe drug, zero footprint, inhalation, biodegradable IV, and nano delivery, smart nanoparticles, targeted brain delivery, light and magnet control tape, reversible agent, built-in antidotes for instant switch off recovery. Suppose muscle relaxation we are giving and we want to reverse it, then antidotes will be available on that next gen anesthetics. Pain-free awake drugs, conscious sedation without awareness loss, ideal for daycare and a minimal invasive surgery. So next gen anesthesia drugs will be very much ideal to zero complications. So 2030 anesthetics will be precise, safe, protective, eco-friendly, and instantly reversible. A true personalized science. So these are the things with genome study monitor, the patient will be having a introduction of drugs in their anesthesia drugs in their body. Next gen anesthesia. So out of all this invention, how we will practice next gen anesthesia? So it will be AI assisted, predictive practice, precision and personalization, closed loop and autonomous systems, with holistic monitoring and organ protection, eco-sustainable practice. There is no scavenging systems are required, green anesthesia, eco-safe, uh, zero eaten drug stage, integration with the surgery and robotics, patient-centered humanistic. So the new generation of anesthesia practice will be intelligent, personalized, sustainable, globally connected, and deeply human-centered. The anesthesiologists of the future will not only deliver safe sleep, but also protect life, organs, and the planet. So these are the things we are expecting in 2030. Suppose today's bispectral index is available with the forehead electrodes. But now in 2030, next gen beast monitor will be with the likes our pulse oximeter probe, and we have a holographic monitor. Everything will be in one monitor only. Whatever the monitors are available in the theater, it will be available only in the one monitor only, and it will be on holographic voice command, everything. So this holographic monitor will monitor about the genome study, then his chemistry, everything. Whatever the dose you are giving, that will be seen. All the organs we can see on the holographic pictures, and anesthetists can decide okay, what is going on in the body also. So future anesthesia of 2030 will be, we can have a like a AI human avatar when the patient we are giving anesthesia. So we can talk with this that avatar. So in future of anesthesia, our AI assistant will act as a co-pilot and we will act as a pilot. And we are human anesthesiologists and they will be having a AI anesthesiologist. So we are pilot, but they are co-pilot likely. And we will decide that within 5 minutes in by holographic monitor, okay, suppose there is a hypotension or hypovolemia, then we will come to know 5 to 10 minutes before that, and we can predict out this and we can save the patients from the anesthesia point of view. And in 2050, my dream is that out of 2030 to 2050, synthetic intelligence will be taking over the artificial intelligence, and our AI will work, synthetic intelligence will, SI will work as a pilot. We will also work as a pilot. Both we will work together, and we both have a human intelligence. We both have a emotional intelligence, everything, and both will be working together to give the anesthesia in 2050. This is the changes will be seen in the future of anesthesia. So we will work as an anesthesiologist, as a AI anesthesiologist in future. So in short, In Anaesthesia 2030, my futuristic vision is smart workstation, next-gen TCI-TIVA pump, futuristic vaporizer, airway instruments, new age drugs, future practice. So Anaesthesia in 2050 will not just be about putting patients to sleep. It will be about intelligent care, organ protection, sustainability, and humanity. So my line take-home message is anesthesia 2030 will not just about safe sleep. It is about intelligence, precision, sustainability, and humanity, where the anesthesiologist with AI becomes not only a guardian of the life, but also a protector of organs, patients, and the planet. Thank you.